Hello, we're going to do Isham textbook chapter 9, disinfection. So please open to page, it's in the book, I swear. 161, look at the learning objectives on 161 and then turn to page 162. Okay, so let's skip the introduction. I'm going to let you read that on your own. In fact, a lot of this I'm going to let you read it on your own, and I fully expect you to. Let's talk about the Spaulding classification system. The Spaulding classification system divides patient care items into 3 different categories based on how they're used, how they contact the patient. So there are non-critical items. And in the Spaulding classification system, non-critical items are things that may touch intact skin, not bleeding ulcer skin, intact skin. Things like thermometers, hydrotherapy tanks, stethoscopes, bedpans. These use intermediate to low level disinfection. So it will kill vegetative bacteria. It's not going to destroy spores at all. Semi-critical, these are things that touch mucous membranes like endotracheal tubes, colonoscopes, esophageal scopes. If it touches your tongue or goes in the other direction, we're talking about a non-clean area, and so it is not considered necessary to have sterility on the things that are going into this area. Semi-critical requires high-level disinfection. High-level disinfection is a disinfection process that will kill all vegetative organisms and even some spores, but mostly it leaves spores. Spores are a bacteria that has gone into a self-preservation mode. They're very difficult to kill. Critical items, these are things you need to sterilize according to the Spaulding classification system. These include surgical instruments, needles, implants. Sterilization is required. These are going into a normally sterile area of the body. Where would you place these? A tongue retractor being used in a tonsillectomy set. Trick question. Tonsillectomies in this case, although it is in the mouth, through the mouth, tonsillectomy needs to be sterile. I tricked you. But when they're removing the tonsil, then they are going to draw blood. Okay, in the green box on page 163, you have all of these terms. Please learn the terms, especially the difference between sterile, high-level disinfection, low-level disinfection, intermediate-level disinfection. These are all very different. Low-level disinfection destroys vegetative bacteria, some fungus, and lipid viruses, but not spores. Intermediate-level disinfection kills viruses, all viruses, mycobacteria, fungus, and vegetative bacteria, but not spores. High-level disinfection will destroy everything and some spores. And then sterilization should destroy everything. Okay. There are many types of disinfectants, intermediate level, low level. We tend to group these together as one group of just housekeeping, okay? Doing surfaces on tabletops, stethoscopes, thermometers, things that don't go into the patient. Intermediate to low. Then there's a huge gulf between intermediate to low and high level, because high level disinfection can kill spores. And then there's a really huge gulf between high level disinfection and sterilization. Okay, on page 164, learn the definition of organic materials. Organic materials can interfere with a disinfectant's ability to do the disinfection. It can make the disinfectant deactivate. Now, we are going to talk about intermediate level and low level disinfectants. There's quaternary ammonium compounds, we usually call quats. Note that it is not sporicidal. It also has compatibility issues with soap. It can be inactivated or absorbed by cotton or charcoal. It's not very effective against a lot of things. It's really useful for doing floors and walls and furniture. Quats. Ethyl or isopropyl alcohol. If you are using this as a disinfectant, it is because the instructions for use on something has called for it to be used, like maybe the contact points on a intravenous pump module. Okay, alcohol though is a better antiseptic than it is a disinfectant. It's really good for animate objects like your hands. Animate. Disinfectants are used on inanimate objects. This is an inanimate object. It is an object. And then there's antiseptics, which are used on animate flesh. So, alcohol is both, but it is not the best kind of disinfectant. It evaporates very fast. And this is a problem because wet contact time for alcohol is 5 minutes, 5-10 minutes. And if it won't stay wet on a surface for at least 5 minutes, it's not going to be a good disinfectant. You probably know from experience that alcohol does evaporate very quickly. Okay. Phenolics are another intermediate level disinfectant that is used for housekeeping. Phenolics will leave a residual film after use, and that film can be reactivated later by damp mopping. So this is a problem if left on medical devices. I have never seen an instructions for use on a medical device or piece of equipment that required phenolics to be used. Housekeeping surfaces, floors and walls. Not sporicidal. Wait, did I say it? Alcohol, not sporicidal. So quats, alcohol. Phenolics, not sporicidal. They will not disinfect well enough to be considered a high-level disinfection. Chlorine. Chlorine is not sporicidal. Chlorine is actually very bad for instruments. I'm looking for an instrument. I don't have one. I was just going to show it to you in case you forgot what an instrument looks like. It's very damaging to the metal. But chlorine may be used if you are disinfecting dialysis machines or hydrotherapy baths, toilets, lavatories, bathtubs. It's used as bleach for laundry and a sanitizer for dishwashing. It is not something that we commonly use in our sterile processing department, but it is capable of killing prions. It doesn't say that in the summary. It's not sporicidal, but it kills prions. How can it do that? Prions are not alive. They're abnormal proteins, and it can destroy prions. But in doing so, it will also destroy the instruments. Chlorine is very, very damaging to stainless steel and other metals. It's an intermediate level disinfectant. It's useful for some things in medical. They use it to treat wastewater and sewage. It's not going to be used on instruments. Now, chlorine and iodophores. Iodophores is the next one. These two things are considered to be halogens. If you want to know what that means, then please look it up. Halogens include chlorine and iodophores. Iodophores are buffered iodines that are also members of the halogen family. Okay, like alcohol, iodophores are used as antiseptics and disinfectants. You'll probably not be using an iodophore to disinfect anything. This is like betadine and iodine. These will damage surfaces of instruments. They stain very, very well. They make everything red. They're good for skin preps. These iodophores are good for skin preps. It's an antiseptic. Okay, moving on to high-level disinfectants. All of those that we just talked about are intermediate and low-level disinfectants. Now we have high-level disinfectants. High-level disinfectants include glutaraldehyde and OPA, which is orthofluoraldehyde, and hydrogen peroxide and peracetic acid. The two main ones that they might be using are glutaraldehyde and OPA. So glutaraldehyde and OPA both kill by a process called alkylation. Okay, that's a chemical reaction where hydrogen is replaced with an alkyl group, which causes the cell to be unable to normally metabolize or reproduce or both. So it's dead in the water. It can't replicate, and it can't eat. So it's dead basically. When you're using glutaraldehyde, you have to, or with any chemical, honestly, you need to consider materials compatibility. So for example, glutaraldehyde is not compatible with latex. If you are using glutaraldehyde, you must use nitrile or butyl gloves. Neither one of these is latex. Glutaraldehyde is not compatible. It will cause the latex to become very porous and sticky, and it'll seep through and get on the person's skin. Glutaraldehyde is usually clear, and it turns green when you activate it. Look at the picture on page 168. It shows the gallon of glutaraldehyde, which is clear, and then the activator, which is in the smaller bottle. You have to mix those two together before you actually have the disinfectant. Glutaraldehyde is dangerous to human life. It needs to be used in a ventilated separate area. Separate designated room would be good. Room that has its own ventilation and 10 negative air changes per hour. If that's not possible, then there's a setup on page 169 on the top of the page. It's a little cabinet where you can use the glutaraldehyde. Glutaraldehyde has a shelf life. I'm sorry, I don't want to talk about the shelf life. I want to talk about the use life. The use life of glutaraldehyde typically is between 14 to 28 days. So once they activate that, they have to document the day that they activated it, and then they can use it for 14 to 28 days, depending on the instructions for use and the facility's policy. So if the facility says we're throwing it away after 14 days, even if we never used it, then that's what you do, because it will only be an effective disinfectant for so long. Each time before glutaraldehyde and OPA are used, they have to be tested with a test strip. So you take the test strip, and it's not this wide actually. You dip it into the solution. You compare it to the color chart on the side of the bottle. If it's in the right color range, then you can go ahead and use it. So it has to be checked before you use it, because, I mean, think about it. What if you checked it after you used it? Would it have passed the test before you used it? Are those things really disinfected? Was the chemical up to the job? Read all of the words about glutaraldehyde. Orthofluoraldehyde. It's very common to use this. There's a huge difference between orthofluoraldehyde. A couple actually. OPA is not as toxic. It doesn't require all of the same safety precautions. It will require safety precautions, but it does not need its own separately ventilated room. Another huge difference between glutaraldehyde and OPA is that glutaraldehyde, if you look at the chart on page 170 at the top, summary of glutaraldehyde, it says that if you want to sterilize using glutaraldehyde, you can, but you increase the soak time up to 6 or 10 hours. So OPA has no sterilant claim on the label. It can't sterilize. But otherwise, As far as the use of these two things, they're very similar use. Or it would usually be something like a TEE probe, a T probe, or a flexible endoscope. Things that need to be high level disinfected by soaking. Okay, on page 171, summary of hydrogen peroxide. We don't really use hydrogen peroxide in sterile processing, not really as a high level disinfectant, but it is capable of being a sterilant. So this is how we'll use it. There's a system called the SteriAD system that uses hydrogen peroxide vapor, gas plasma, and then there's the VPRO system that uses vaporized hydrogen peroxide. Both of these, at the concentrations they're used, are sterilants, but we don't generally take something and soak it in hydrogen peroxide. Hydrogen peroxide is pretty corrosive to some materials. And if you're using it out there, I'd be surprised, but let me know what you're using it on and why, and send me a copy of the IFU. Okay, parasitic acid. You might actually be using this quite a bit. You might have an AER in your department that is capable of sterilization. But, okay, I gotta slow down. Parasitic acid is capable of sterilization. And when you put a scope in a parasitic acid machine, it can get the scope inside sterile. But when you open the door on that machine, there's no protective wrapping on the scope, so it is instantly no longer sterile. So it's good enough for high-level disinfection. High-level disinfection may have some inactive bacteria on it, and that's considered okay in most cases. Sterile should not have any bacteria on it. So not having any protective wrapping because it is a wet process, the parasitic acid process is wet, there's no protective wrapping. So it's going to become sterile but not remain sterile. Parasitic acid is corrosive to some materials. Pause. Unpause. Okay, page 172. Look, it says read the IFU or follow the IFU to achieve desired results. How many times do you think this book says instructions for use or IFU or some variation thereof? A lot. This is really important. So the blue box says, before using a chemical disinfectant, be sure to review the manufacturer's instructions for use. Using the correct chemical the wrong way is just as dangerous and possibly dumb as using the wrong chemical. Preparation instructions for chemical disinfectants. You should always know the IFU and the appropriate concentration for use, how to dilute it, the correct temperature required, and the water quality and pH requirements. Read the important safety note. Okay, contact time. Wet contact time is extremely important when you're using disinfectants, which, by the way, are all liquid. They're all liquid. So the disinfectant must be wet on the surface of the item being disinfected for a minimum amount of time. Let's just, we'll go back to the alcohol. How are you going to keep something wet with alcohol for 5 minutes? If you're soaking it, it'll stay wet for 5 minutes. But if you just spray it on or wipe it on, it's going to dry up really fast. So in sterilization, we have the steam contact time, right? In disinfection, you have wet contact time. It doesn't matter what the chemical is. It needs to remain wet on the item for the minimum time. So if it dries out before the minimum wet contact time, you have to start a whole process all over again. There's another kind of disinfection. Have you ever heard of pasteurization? So pasteurization is a type of thermal disinfection. using heat. With pasteurization, you may be familiar with how milk is pasteurized. They heat up the milk to about 150 to 170 degrees and keep it there for about 30 minutes, and that kills the microorganisms that are inside the milk. So we can do something like pasteurization. It's called thermal disinfection, and we can do it right in our washer disinfector machine. So at the end of the cleaning, after the cleaning is all done, the last thing that's going to happen in that washer is it's going to spray 180 degree water on the surfaces of the instruments for a preset time. And that will kill any remaining vegetative bacteria. It is not sterilizing it, it is disinfecting it. And it is not exactly the same as pasteurization. And it uses heated water to kill bacteria. Okay, on page 174 and 175. On 174, the bullet points list some advantages of using an AER. I think one of the biggest advantages really is that it's not going to take shortcuts. If you look at these bullet points, and you're probably going to get this, the machine is going to do everything the exact same way every time. It's not going to take shortcuts. It's not going to say, I want to get this scope done so I can go to lunch. It's not going to say, I need to get this done so they can have it in the room. It's going to do step-by-step process the same way every time. So that means that it's going to be doing the right wet contact time, that it's going to use lots and lots of rinse water. An AER stands for Automated Endoscope Reprocessor, but it has definite limitations. Endoscopes cannot be cleaned in the AER. They can be disinfected in the AER. They can even have a detergent flush through them, but they can't, there's no AER that can brush the lumen or wipe the external surfaces. So anything that goes into an AER still requires the manual cleaning portion. On page 175, minimum effective concentration testing. So minimum effective concentration is the bottom line usefulness of the chemical. So here's the test strip I was talking about. See, it's quite a bit thinner than this. Okay, so the test strip is put into the solution, you pull it out, and you can compare the color result to the little color dots on the side of the bottle. It's very simple to use. There's a lot of documentation when you're doing high-level disinfection. A lot. So look on page 176. You need to log things like the patient's ID, the doctor, the procedure, what's being processed, who you are, who you are the person that cleaned it, who you are the person that's disinfecting it, what is the disinfecting solution, what date does the solution expire, the result of the test strip, quality test, so you actually have to test the test strip itself, and then the minimum effective concentration test results. Okay, you get it, you can read. In conclusion, I'm leaving it there, and I will see you soon.